Hi, thanks for watching this short video where I'm going to talk you through physical inspection of your scanner and probes. My name's Nick Dudley. I'm a physicist who's worked in medical ultrasound for over 40 years, almost half of that with a clinical role. I've always had an interest in quality assurance, both of the equipment and the imaging process. Now, physical inspection's a very important part of the QA process. You need to be doing this at all stages. Damage might lead to a cross-contamination risk or an electrical safety hazard, or poor imaging performance. In my hospital, 40% of faults are due to physical defects. I'm going to describe it separately from all the other tests because it should be done as part of acceptance testing and all other stages of the process. The first thing we should do when a new scanner or probe arrives is a thorough physical inspection. You should never accept anything that isn't in perfect condition. Unless it's bought as used, then it might be acceptable to have some cosmetic defects. Don't accept anything that looks unsafe. Once a system's in use, it should be checked for physical defects on a regular basis. So what are we looking for? First, have a look at the console, monitor and scanner body for any damage to the panels or controls. Damage might not be an immediate risk, but it does need fixing. Check the cables at the back, such as the mains cable. Make sure this is either unplugged or the socket switched off, otherwise you could be electrocuted if there's a fault. Check the network cables. Now, these cables at the back can be trapped or run over, even when a scanner's never moved from the room. I've often found cables between the wheels of a scanner, so clearly they've been run over. To check the cables, run them between your fingers looking for nicks or cracks in the sheath, or any kinks or bumps that might suggest internal damage. Any damaged cables should be immediately replaced. Have a good look at each probe, looking for damage to the case or lens or any split seals. All of those could pose a cross-contamination or electrical safety risk. Inspect the probe cables starting from the strain relief, which is often a point of weakness. Again, run the cable between your fingers, looking for nicks, cracks, kinks or bumps. If you suspect cable damage, it's important to see if there's any impact on the image, which I'll talk about in acceptance and user testing. If there are cracks or splits in the cable or the strain relief, then these need repairing or replacing before the internal wiring is damaged. Now let's have a look at a few faults. This console's badly cracked. It can't be properly cleaned, and there's an expensive circuit board underneath, so if any fluid gets in it, it could be seriously damaged. This needs an urgent repair. This lens has been very severely damaged, almost completely stripped off, and the probe's unsafe to use. This lens has a small hole in it, and it's now impossible to clean, so it shouldn't be used. It might fail an electrical safety test. This lens shows the consequences of repeated cleaning without enough care. It's worn through at the corners. It might still be possible to clean it properly, depending on the depth of the holes, but it might fail an electrical safety test, so it should be tested straight away and replaced if it fails. Imaging performance will probably still be okay. This type of damage is preventable by avoiding abrasive cleaning materials like paper towels and never rubbing the lens, just wiping. Here the case has split at the joint. This happens in some probe models just due to the stresses in the case, or it might be due to an impact. It's now impossible to clean, so it shouldn't be used. It might fail an electrical safety test, but usually there's some additional protection inside the probe. Professional rebonding is an option for this sort of damage. Here the case has split near the cable end. This is still a cross-contamination risk, but lower risk than the previous example. Again, rebonding is an option for this one. Moving on to the cable, the strain relief at the probe end is often a point of weakness. Once this happens, there's a risk of internal damage to the cable, so an urgent repair is needed. It's possible to remove the strain relief and mould a replacement. This probe cable may have been trapped or run over. There's a risk that the internal cable was damaged at the same time. This needs an urgent repair or replacement. It's important to report physical faults as soon as you find them, in case there are safety or imaging issues. So it's good practice to have a look at the equipment every time you use it and to do a regular documented inspection. Hopefully once you've found defects, you'll be able to find ways to prevent some of them.